Hello everyone. So today we will discuss about the national immunization schedule given by WHO. Everyone is asking about the vaccination. So vaccination is divided into three categories: vaccination of infants, vaccination of children, and vaccination of pregnant women. So we will discuss one by one about the vaccination of the children, vaccination of women, pregnant woman, and vaccination of infant. So in this video we will discuss about vaccination of infant. The first vaccine is BCG, that is BCG vaccine is given at birth or as early as possible. So it is given at birth or as early as possible till 1 year of age. So remember, 1 year of age is important. It is the MCQ. So what is the dose of BCG? The dose of BCG is zero point 0.1 ml or 0.05 ml until 1 month of age, 0.05 ml until 1 month of age. So what is the route? Route is given intradermal. So intradermal is route given BCG vaccine at birth. So it is a question that it is given intradermal at left upper arm. So it is important left upper arm. So BCG. Next vaccine is hepatitis B birth dose. So it is birth dose. So remember, hepatitis is also given to adults. So birth dose. Then at birth or as early as possible within 24 hours. So it is important that it gives within 24 hours. Then what is the dose? 0.5 ml. So dose of hepatitis B birth dose is 0.5 ml given intramuscular. It is given intramuscular. And what is site? Site for hepatitis birth dose is anterolateral aspect. It is given intramuscular. So hepatitis B is given intramuscular anterolateral side of mid thigh. It is important. Okay. Okay. Then third vaccine is OPV, that is oral polio vaccine. At birth as early as possible within the 15 days. 2 drops orally is given. So the importance of the dose and the time of the vaccination is important, because in Viva or in MCQ they will ask that a 1 month baby which has the history of no vaccination, that is from birth the baby haven't given any of the vaccine, so what vaccine you will give. So if 1 month baby is comes with history of no vaccination, then BCG is only given, because OPV and hepatitis B are given 24 hours for hepatitis B and OPV 15 days, but we can give BCG up to 1 year. So it is important. So at birth, 3 vaccines are given: BCG, hepatitis B, and OPV. Then moving forward, at 6 weeks, we give OPV 1. So OPV has 3 doses, that is 1, 2, 3, and given at 6, 10, and 14 weeks. OPV can be given till 5 years. It is important. OPV can be given up to the 5 years. It is important that at what maximum age which vaccine is given, because in MCQ or in Viva they will ask a 2-year baby comes with no history of vaccination, 1 month baby comes with no history of vaccination, 6 month baby comes with no history of vaccination. So you have to know that when and up to what age limit the vaccines are given. So OPV 1, 2, 3 at 6 weeks, 10 weeks and 14 weeks, 2 drops orally. Okay. Then next vaccine is pentavalent. Pentavalent vaccine is very important. First, before pentavalent there is trivalent vaccine, that is DPT, that is diphtheria, pertussis and tetanus. Then in pentavalent, hemophilus influenza and hepatitis is added. So pentavalent is the newest vaccine and it is given at 6, 10 and 14 weeks and can be given till 1 year of age. OPV can be given up to 5 years, but pentavalent given at 1 year. So if baby comes after 1 year without a history of vaccination, you should give OPV first dose, not penta. Then you will change penta to DPT. Okay. Then 0.5 ml is dose intramuscular anterolateral thigh, mid thigh. Okay. Then next is pneumococcal conjugate vaccine. It is very important because it is newly added in immunization schedule. So examiner or MCQ might come from PCV. 2 primary doses at 6 and 10 weeks and 14 weeks. 10-week dose is not there. 10-week dose is not there, so it will be a MCQ. 2 primary doses at 6 and 14 weeks followed by a booster dose at 9 to 12 months. Okay. And it is given 0.5 ml intramuscular anterolateral thigh. So no 10-week dose to PCV. Then the most common vaccine, rotavirus, given at 6, 10, 14 weeks and can be given to till 1 year age. That is, it is similar to pentavalent. And 5 drops, it is very important. 5 drops liquid vaccine, 0.25 ml lyophilized vaccine. Okay, 5 drops, that is 2.5 ml, and it is a lyophilized vaccine, and this is the MCQ. Okay, then oral and given as oral 6, 10, 14. PCV, you have to remember no 10 weeks of the dose. Then IPV is there. OPV is done, then IPV. 2 fractional dose at 6 and 14 weeks of age. Here also no 10-week of dose. 0.1 ml dose is important of IPV, that is 0.1 ml. Everywhere you see 0.5 ml, but only in BCG and in IPV you see 0.1 ml dose intradermal, 2 fractional dose and right upper arm. और एक वैक्सीन है जो लेफ्ट अपर आर्म में देते हैं एंड वो भी इंट्राडर्मल, दैट इज नथिंग बट BCG 0.1 ml. IPV also 0.1 ml intradermal, but in a right side IPV, polio always right. Okay, remember polio always right. Then most important vaccine also MR, that is measles and rubella. First dose 9 completed months to 12 months. Measles can be given up to 5 years of age. Measles and OPV. 5 years, 0.5 ml. The most important question is the route of the measles vaccine, that is the subcutaneous right upper. So remember, in the left we give two vaccine, that is BCG and the Japanese encephalitis. Okay, two are left arm vaccine and two are right arm vaccine, one intradermal and other two are subcute. Two subcute vaccines are Japanese encephalitis. Japanese are left-handed. Remember, Japanese person are left-handed and MRR is ending so right hand. Remember, subcutaneous two vaccines, MR and JE, and both are given 9 completed months to 12 completed months, 0.5 ml subcute. If JE ask intramuscular also given, but it is killed vaccine which we give intramuscular, but subcutaneous live attenuated vaccine left upper one. Japanese are left-handed and right-handed are MR and 0.5 ml subcute. Then vitamin A at 9 completed months with MR and 1 ml, that is 1 lakh international unit oral. Okay, so here is the total immunization schedule of the infant. What you have to remember, two vaccines are intradermal, that is BCG and IPV. BCG is a left upper arm, polio is given right upper arm, 0.1 ml. Then Japanese encephalitis and measles. Japanese are left-handed subcutaneous and measles right hand subcutaneous, 0.5 ml. Okay.